Good afternoon, everyone. My name is Christy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, the Honourable Ian Rankin, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Christy. Good afternoon, everyone. I want to start by acknowledging the tremendous turnout we've had over the last few days for testing. It's just incredible. Between Friday and today, over 21,000 Nova Scotians lined up, even if they had no symptoms for testing. Constant and deliberate testing is a key mitigation factor when it comes to COVID-19. So let me get to the case numbers for today, and you can see the effectiveness of testing. Today we are reporting one case in the northern zone. It is the result of a close contact with a previously reported case. We now have 29 active cases. 4 are in the hospital, 2 of whom are in the ICU. Unrelated to the case being announced today, 2 more cases of the UK variant and 5 more cases of the South African variant have been identified by the National Microbiology Lab among Nova Scotia residents. 2 of those cases are resolved and 5 are in self-isolation. However, the fact that these variant cases were identified in the province speaks to our decision last week to announce some limited restrictions. These decisions are not taken lightly because we understand the impact on businesses, especially those in the service sector who have really suffered throughout the time of COVID-19. We know the restaurants and that other service sector businesses such as spas, gyms, hair salons, and barbershops have stepped up during the pandemic to ensure that their patrons and all Nova Scotians are safe. Today, in recognition of the service sector, these small businesses that are really the backbone of the Nova Scotia economy, I'm announcing a $7 million plan to help with the impact of COVID-19. The Small Business Real Property Tax Rebate Program provides qualified businesses a one-time rebate of a portion of their paid property taxes. Qualified businesses can choose either $1,000 or 50% of the commercial real property taxes paid for the final 6 months of the 2021 year. That's approximately 3,300 small businesses eligible, including full-service restaurants, bars, gym and fitness facilities, hair salons and barbershops, spas and nail salons, and body art establishments. This is cash in the pockets for restaurants and other small businesses in the service sector. Yes, it is based on property taxes, but is designed to be used for business owners to support any aspect of their business, including hiring staff or paying the bills or ordering supplies. We recognize that restaurants have put in mitigation measures such as plexiglass, other forms of PPE, and enhanced cleaning. We know that other service sector businesses have also suffered, and today's announcement is meant to address that. Thank you, and now I'll turn things over to Dr. Strang.
Thank you, Premier, and good afternoon, everybody. As the Premier noted, we are announcing only one new case today. That's good news. The National Microbiology Lab confirmed 7 new variant cases, 2 UK and 5 South African. This brings the total number of cases of the UK variant in Nova Scotia to 8 and the South African variant to 6. The 2 UK variant cases are connected to a previously reported UK variant case. And of these 2 new cases, one is in Western Zone and one is in Central Zone. These people were tested late last month. One case is considered resolved, the other remains in self-isolation. All close contacts of these 2 cases in Nova Scotia have been tested, and so far only one person has tested positive. We do not have variant results for this case, but we have to assume that they also are the UK variant. 5 cases in the Central Zone have been identified with the South African variant. The initial cases related to travel, or international travel, and the other 4 cases are household contacts of that traveler. The case related to travel is now considered resolved, and the other 4 cases remain in self-isolation. From the 4 household contacts of the South African variant cases, a number of contacts have been identified. Some of them are still under investigation, but so far only one of them has tested positive. So we can conclude that at this point, this individual as well, who's just recently tested positive as a close contact, also has the South African variant. But unfortunately, at this point in the case investigation, no other additional contacts have been identified, but we are still investigating some of those, this whole case cluster. But ultimately, at this point, there is no indication that we have community spread from either of these clusters of variant cases. The case numbers we are seeing since last Friday are very positive. They have stayed low in the single digits for the last 4 days, and the new cases are connected to travel or close contacts of positive cases. This is welcome and somewhat unexpected. That this is also good news. It's because unlike some other cases, we can, as I said, the recent cases, we can confirm a source of infection, which is different a position than we were last Thursday, Friday. I do want to thank Nova Scotians for answering Friday's call to be tested and the large numbers of people that have come forward. On the weekend, more than 15,000 people went to get tested, and there's been more in the last 24 hours. It's for a total, as the Premier said, about 20,000 Nova Scotians. This is a staggering number, and it shows how much Nova Scotians want to keep themselves and their communities safe from COVID-19. Just as a bit of an interesting comparison, that more people were tested over the weekend for COVID-19 by our lab than all of the people who were tested during the entire H1N1 pandemic in 2009. So we want to say a big thank you to everyone who got a test and to all of those who worked to meet that demand, from the lab staff and the healthcare workers to the volunteers at our pop-up clinics. Thank you all very much. It's important that we make testing a part of our COVID-19 precautions. If you don't have symptoms but you spend time with a lot of people, get tested regularly. And if you are feeling like you have the cold or flu, even one mild symptom, it's important that you isolate and get tested as quickly as possible. The good news in all this testing over the last few days is, as I've said earlier, there are just a few positives. An example of that is that everybody who was working at the Irving shipyard has been tested, 1,500 to 1,000 people, and no additional positives were found. But we need to continue our testing. We need to continue to watching our epidemiology for the next few days. If the pattern continues that we're seeing, we may be in a position to lift restrictions much earlier than March 26th. I know that would be very welcome news. We will continue to assess our epidemiology over the next couple of days, and we'll have more to say about this on Friday. And I know this weekend I heard quite a bit of criticism about the restrictions we brought in on Friday. People are comparing situations and circumstances that quite, from a scientific or a public health perspective, are actually not comparable. People are asking, why can't we go play hockey games when people can go to video games at a local arcade? But there is a science on how the virus is transmitted. Players at hockey games or other sports are not masked, and they're making contact with other players on the ice. There's no physical distancing. At an arcade, people are wearing masks, they're staying physically distanced, their hand washing and equipment is frequently cleaned. So the reality is that this is a much safer environment than playing hockey or other sports. And I do need to point out the fact that one of the key factors in the Newfoundland outbreak was a high school volleyball tournament. When I look back at the restrictions that we brought in last November 27th, my conclusion has to be that we would have been better if we had done that a week earlier. And that was certainly on my mind last week. If we'd done what we did in November a week earlier, we may have gotten a better handle on things, and maybe the restrictions that were needed at that time wouldn't have lasted as long as they did. When there's a troubling pattern of positive cases, such as what developed last week, along with no obvious sources of infection and the possibility of an easily transmissible variant, that was what we were faced with last Thursday, and I became very concerned. I looked at the evidence, the science, and the opinions of my very qualified public health colleagues. I made a clear recommendation to the Premier, and as much as some people are frustrated by the decision, or maybe don't understand it, I believe that was the appropriate and necessary decision. And that even more so now that we've confirmed that we have 7 more variant cases today. Luckily, these cases don't appear to have spread like we have seen happen elsewhere, but it could have happened. I would rather impose restrictions very early than wait and be too late and have a rapidly spreading outbreak of a variant like as what has happened in Newfoundland. I fully recognize that restrictions are challenging, that they're frustrating to people, but we have remained a very COVID-safe place by acting decisively, quickly, and strongly when we see signs of trouble. Doing so minimizes the chances of Nova Scotians becoming critically ill and puts us in a position for the earliest possible recovery. But please be reassured, we are watching closely and we will adjust our approach when we think it is safe. And right now it is looking very good. So I ask Nova Scotians who have stayed with us so far to please hang on a little longer. We are getting closer every day to our goal of at least 70% of Nova Scotians vaccinated, and when that happens, restrictions should become much less needed. This is something we will be able to look back on ultimately and say, look at what we all did to keep each other safe. On the vaccine front, and I know there was a technical briefing earlier today, so I'll just give a summary of where we're at with vaccines. Our rollout is on track still remains on track to immunize at least 70% of Nova Scotians by the end of September. Last week, we started sending letters to about 4,500 Nova Scotians over the age of 80. The letters are being mailed out in batches over 8 business days, with the final batch going out this Friday. So if you didn't get a letter yet, you will still receive one. Again, these are just general letters informing you how to sign up for an appointment. They are not invitations. If you don't have a letter, don't worry. You do not need to have a letter to book an appointment. Anyone who turns 80 after March the 1st will not receive a letter, but they will still be able to book their appointment on the day that they turn 80. As we talk about booking appointments, yesterday booking opened for Nova Scotians 80 and older in 4 of the 10 community-based clinics across the province. Although we had planned for an increased traffic to the booking site, we did not anticipate the overwhelming number of people who on day 1 would try to log on or call for an appointment. I know it was frustrating for the people trying to book their appointment. But if there's a silver lining in that, it is recognizing the interest and the fact that so many people are anxious to get a vaccine as soon as possible. But despite the setback with the online booking system and the busy phone lines, those problems have been resolved. The 2,300 available appointments have been booked. And as was explained in detail at the technical briefing, for people who tried to book an appointment yesterday and were not successful, I asked them to be patient, not to worry. Many more appointments will become available soon as we adjust to the anticipated increase in interval between vaccine doses. As soon as that is confirmed, we'll be able to open up our appointments for a much longer period. In addition, as more vaccine shipments arrive, we will increase the number and frequency of appointments at clinic sites across the province. We'll certainly let Nova Scotians know through government social media channels, through these COVID-19 briefings, and many other ways when more appointments are available. Next Monday, we open booking for 3 new clinics that will start on March the 15th. And the following week, we will open bookings for the remaining 3 clinic locations that will open March 22nd. And the reason we have to stagger those is simply within the vaccine supply that we have available. A change has been made to the booking system to limit the number of users who can access the site at one time. Nova Scotians who try to book online will be placed in a queue and provided a waiting time. So as those ahead of them book, the online page will automatically load up for an individual when it is their turn to book an appointment. The wait time is based on how many people are trying to access the site at one time. So if you go online but cannot access the site right away, please be patient and stay online, as you will get access soon. Repeated logins or people who are on telephone booking, redialing the telephone booking line actually make the problem and clog up the system even more. We ask for your patience as we work through the rollout of the early rollout of this program. We're also proceeding with 4 pharmacy prototype clinics this month. The schedule for these initial clinics are March 9th in the Halifax Regional Municipality and in Shelburne, March 16th in Port Hawkesbury, and March 23rd in Spring Hill. I can't stress this enough, that these are prototype clinics at each of these 4 pharmacies in the province. Please do not call your local pharmacy looking for a vaccine. We don't have vaccine brought widely at pharmacies. These 4 pharmacies who are participating in the prototype will contact their clients directly to book an appointment. They know who their clients are. They know those who are 80 and plus, and they will be reaching out to contact you. They will do this starting with their oldest clients first and then working back based on date of birth. Each of these clinics have a limited supply, just under 600 doses each to provide, so that's 300 people for first and second dose. Again, this is by invitation only. If you call to try and book, you won't be able to do that. If you show up at the clinic without or at the pharmacy without an appointment, you won't be able to get immunized. These are, like we did for the 80-plus clinic at the IWK, these are prototype clinics that will help inform any changes in how the vaccine is delivered through pharmacies when in April we open up access in a much larger number of pharmacy clinics. We will also soon be moving into our second group of healthcare workers. In keeping with our age-based approach, the following healthcare worker groups will be booked, starting with those who are 60 years of age and older, and then working backwards in 5-year increments. So those healthcare workers are going to start to be able to be immunized through our healthcare worker clinics, which are in our hospital facilities. These include doctors, nurses, and continuing care assistants, dentists, dental assistants, and dental hygienists, pharmacists, pharmacy assistants, and pharmacy technicians. These people in these groups will receive an invitation to schedule their appointment in the next few weeks. It's important to note that our vaccine rollout is not completely sequential. We are not finishing one group and then moving to the next. We have several different groups receiving the vaccine at the same time in different locations. We have long-term care facilities. We have our health care clinics for healthcare workers. We're now moving into 80-plus community clinics and very quickly into pharmacies as well. And as we near the end of one group in our sequencing, we'll move to the next, so we'll never have unfilled appointments. We have a measured and steady approach to getting vaccine in arms, but we're also doing that as fast as possible. Our approach is really go big and go fast. We want to immunize as many Nova Scotians as fast as possible so that those who are not yet immunized will be better protected because those around them have received the vaccine. We're building population immunity. So that's why in the initial phases, even as we enter a more robust supply, we're focusing on larger locations that can immunize large amounts of people quickly. And yes, there are going to be people in some risk groups and some living conditions that it's not easy to access them in large numbers. We will get to them as quickly as possible, but we're building protection for them by immunizing that the go big, go fast. The higher the population immunity and the quicker we can build that up, that provides protection for everybody by decreasing the chance for the virus to circulate. And ultimately, there will be an opportunity for a vaccine for every Nova Scotian who wants one. People may have heard that the third vaccine was licensed in Canada on last Friday, the AstraZeneca vaccine. AstraZeneca is different than the two vaccines we're using now. The Pfizer, BioNTech, and the Moderna are mRNA vaccines, which have been shown to be 94 to 95% effective in preventing symptomatic COVID-19 illness. The AstraZeneca is slightly different. It's called a viral vector vaccine, and it's been shown to be about 62% effective against presenting symptomatic illness. Yesterday, the National Advisory Committee on Immunization released recommendations on this vaccine and are advising that it be given to people 18 to 64 years of age if the advantages of early vaccination outweigh the limitations of a less effective vaccine, if the ease of transport, storage, and handling of this vaccine make it easier for certain groups to access it, and people are fully informed about this vaccine and the availability of other options. We have been offered an initial shipment of 13,000 doses, and these will expire in a month's time, and we would need those. Therefore, we would need to have a plan to use them immediately. So we are actively looking at what is the best use of this AstraZeneca vaccine at this time for Nova Scotia. In conclusion, I'm asking Nova Scotians to hang in there. Please continue to follow both the letter and the spirit of the public health measures and restrictions. Just because you can do something doesn't mean you should. Continue to keep your social circles small and consistent and reduce activities outside of your home, school, and work. Get tested regularly, and if you feel the cold or flu coming on, get tested right away. I do see better days ahead. We are forecasting a consistent and higher volume of vaccine supply coming to Nova Scotia. And with the news that the time interval between the first and second dose of the Pfizer and Moderna vaccines it will be significantly increased, that will mean we don't need to hold back the second dose and can get more first doses in arms much more quickly. And that will allow us to reach population immunity for COVID-19 faster. We're just waiting for final confirmation of that through the release of a NACI statement. We will still need some of the public health measures to stay place even after September, but by the time we get there, we will be far better protected from the vaccine. And I think we'll be able to look back and say each of us did our part to keep Nova Scotia safe during this pandemic. Premier.
We'll now take one question and one follow-up from reporters in the room and on the phone in the amount of time that we have for today. We'll start with Lindsay Armstrong with All Nova Scotia.
Thank you. Hi, Premier. This past week, Liberal MLAs have been voting down in-person meetings, citing fears of their personal safety in some cases. I'm wondering if you share these concerns about the safety of physically distanced in-person meetings.
I think that it's, having not been at the meeting, I don't know the discussion that was had, but I think we're going to need to make sure we follow the restrictions, not only to the letter of the law, but making sure that we set an example as public officials. We're engaged in discussions, the three House leaders, about how the legislature will look. I prefer to be in person for some meetings. I went through a leadership campaign where there was challenges in doing that, and we had a lot of virtual discussion and debates, and it's a balance of trying to figure out what works best for everyone.
Go ahead with your follow-up, Lindsay.
That it has occurred at several meetings in the past week and a bit, and I'm just, representing your caucus. I'm wondering what you would say to truck drivers and teachers and grocery store workers and countless others who are working in person, as they're required to be, when your caucus are telling us that they are not willing to.
Yeah, and so again, there's a lot of factors where the space is and the civil servants that would have to be there to ensure the safety of the restrictions being in place, travel into Halifax for those meetings. I prefer to be in person when possible. That's my preference. I can't speak to the way members vote at committee. I certainly didn't tell them which way to vote. But I've asked the House leaders to see how we can be, at least some of us, be in person for the upcoming House session. So I look forward to how those discussions evolve.
Next question will go to Mike Gorman with CBC.
I don't know who wants to take this, or perhaps both of you, but I wonder if the failure with the website yesterday should have been anticipated and prepped for. And what I mean is, we knew that this was going to come. We knew there would be a big demand for this. And it was sort of opened up widely as opposed to trying to book based on cohort, whether alphabetical or some other approach. Was yesterday avoidable?
I think you heard ADM Barber speak to that question as well. That certainly at the outset, what I've been briefed on, there was a much higher than use of the website than would be expected based on our population. Given the number of people that are 80 plus. So either lots of people, and we're hearing lots of anecdotes of people just going on to test it even though they're not in the age group, or there's also some concerns about, this has happened elsewhere as well, about a more nefarious, if you will, activity that kind of clog an online booking piece. So it's happened. Whether it can be fully prepared for and anticipated, I'm not sure there's there's a clear answer to that, but certainly it has been fixed, and now steps have been put in place to, as we talked about, so protect that site. So if there's a large surge, they go into a waiting room, and then they'll be pulled in as they can be. We're also looking at, if necessary, even within the 80-plus cohort, maybe doing things by month of birth or by last name, so minimizing the chance for a large surge of people at one time.
Thanks. Dr. Strang, you talked about this in the tech briefing, but when it comes to the province's second dose holdback strategy, what exactly are the recommendations you're waiting on? We've seen BC already take some steps. So is it similar to what's going on in BC, or is there something else potentially coming that allows you to revisit the approach that you've been using so far?
So it's unfortunate that BC got out ahead of a national process. We typically wait for the National Advisory Committee on Immunization to release recommendations, and we're waiting for that. That's likely to happen tomorrow. So what we're expecting is a significant increase in the time frame between first dose and second dose. Until we get the NACI recommendation, I'm not going to speculate on what that may say, but we're certainly anticipating a significant lengthening of that interval. What that means is that we can move away from our current process. The current recommendation is that the vaccine, unless there's extenuating circumstances, should be given 21 to 28 days apart. Because of that, and because of our fortunate epidemiologic position, we've held with the policy that we will hold back the second dose to make sure that the individual who gets dose 1 will have vaccine for that 21 or 28-day dose. Now, that as we anticipate that's going to be that interval is going to be lengthened substantially, we will move away from that, and we'll be able to focus all our vaccine on first dose into people's arms, which means that we can get far more. You can get double the number of people with a given amount of vaccine with first dose. So we'll be able to reach a place where we have Nova Scotians, a significant proportion of first dose of vaccine in their arms much faster now with this. So this what we're anticipating coming from NACI is quite a game changer for us.
Next question will go to Tim Biscay with the Halifax Examiner.
Yeah, I asked this, I'm not sure who I'm asking. I asked this during a technical briefing, but I guess I'll rephrase it. There's been, in other jurisdictions, especially in the U.S., queue jumping in terms of health departments trying to direct vaccine to communities. And it happened here, too, with the first community clinic. We learned today that 50 people jumped the queue who weren't invited to that. Are you putting in place processors or even potential penalties to prevent queue jumping and then to penalize people who actually do?
I mean, the main approach is that based on if it's going to be going by age, and we know what your age, the system's set up, because the vast majority of people will have MSI. We know what people's date of birth is. So if you're trying to book a clinic for this initial phase for 80 plus, if I went and tried to book a clinic, the system just would simply not let me. So certainly trying to jump the queue based on age is not going to be feasible in our system. And beyond that, I think, once we get large amounts of vaccine, as Dr. Watson-Creed said, when we get into a space where we have large amounts of vaccine, queue jumping is not nearly so much of an issue. But at the end of the day, we're going to sequence things, and we have, basically mostly based on age, which will allow us to keep people in that queue. I think it's really important that, like everything else we've asked Nova Scotians to do throughout this whole pandemic, do the right thing, look after each other, don't think about just yourself, put others first. And we would ask the same as we start to roll out this vaccine program. Everybody will get a chance. And now with this anticipated change from NACI, you're going to get a chance soon. We're in a fortunate position because of all the hard work everybody's done. Our epidemiology still remains good. So it's going to take time to roll out the vaccine, and we ask people to be patient. Everybody will get their chance to get a vaccine, and we anticipate doing that much sooner than we were initially planning, based on the pending change from NACI around the interval.
Go ahead with your follow-up, Tim.
I'm just wondering if you could expand a little bit. I understand you're still studying it, but the AstraZeneca vaccine, given the lower efficacy of the vaccine, what might be the type of uses for it in Nova Scotia?
So we're looking at, and I'll tell you more about where we can't use it. First of all, it's only licensed for under 65 because of the lower effectiveness from an individual health reasons and a public health reasons, as well as for ethical reasons. It's not a vaccine we could offer for people who are at higher risk because of a health condition or going into communities because of underlying factors. They're at a higher risk for an outbreak of COVID-19. It wouldn't be right, nor would the science support it, to use that vaccine for those populations. So what we're left with is the potential uses could be in younger, otherwise healthy people, those who are right now at the bottom of our sequencing list. We also have to understand people need to have a choice, that ultimately they're going to have if we use the vaccine, they could make a choice for a less effective vaccine now, but knowing that in 2 to 3 months they're likely going to get one of the mRNA vaccines much more effective later. So there has to be an informed consent process around this as well, that people know very clearly the options that they've been given. And the last piece is that this initial allotment has a very short expiry date. We have to use it within a month. So there's a number of challenges that when we figure out what is the best use of this vaccine for Nova Scotia, that we're working our way through that, and we'll be bringing forward recommendations very quickly to the Premier.
Next question will go to Keith Doucette with the Canadian Press. Keith.
Yes, I'm just wondering, in the technical briefing, they said that if we deviate from the age-based approach, that would slow the process. So I'm just wondering, you just talked about AstraZeneca. Could this potentially slow the process that you're talking about here, and how would it do that?
I mean, that's one of the issues we're grappling with. How do we use this in a way that doesn't take us off target with our main program, which is rolling out the AstraZeneca and the Pfizer and the Moderna vaccine as quickly as possible for Nova Scotians?
Go ahead with your follow-up, Keith.
And I'm just wondering about, according to BC, we're looking at up to, I guess, 40 days between vaccines. Does that sound about right to you? I know that you're waiting on the feds, but do you think that's feasible for Nova Scotia?
So 40 days is where a number of provinces currently at, and the NACI recommendation would say that if there's extenuating epidemiologic or supply issues, that provinces could extend up to 42 days, and a number of them are already using that. What we're expecting to hear from NACI is a significant extension beyond that 42 days.
Next question will go to Natasha Pace with CTV.
Thank you. Premier, I'm just wondering, the rebate program you announced today, the $7 million program, does that go far enough, do you think, to help businesses who are struggling with restrictions?
Well, what we looked at is the support that they've been able to get in the past, federal government support, especially with employees with the CERB benefit, but also with the rental assistance program. We've looked at our programs that we've helped with our struggling tourism sector in the past, and that went out. We're also going to be looking at another phase for that industry. Hotels continue to struggle without our visitors coming into the province. So this was the right amount that I thought was required. A lot of the restaurants have been reduced in capacity because of restrictions, every second table, plexiglass, and really taking away the amount of customer base they've been able to have. The reduction of hours as well is something that I'm cognizant of, and the 50% was meant to allow them to have the cash flow that they were required to help sustain their businesses now, and I've said that I would be there for them, and this is part of that commitment.
Go ahead with your follow-up, Natasha.
Okay. Dr. Strang, for the Premier, I know, Dr. Strang, you talked a bit about the backlash, I guess, that you've been hearing from people who are upset about the latest round of restrictions and how some people feel it's a double standard, to take away sports and that kind of thing. Can you just talk about how difficult it is to make a decision to impose restrictions like you have been having to do over the last year?
Well, it's not easy. I'm fully aware of whether it's limiting hours in restaurants, reducing opportunities for sports or theater activities. I'm fully aware of what that means to people, right? So it's not easy. But I'm also fully aware of what happens when you allow COVID-19 to spread widely in the community, and what that means to people. We saw in the first wave, people will die because of that. We'll have healthcare workers put at risk. Other essential workers like grocery store workers. People who have been willing to put to keep coming to work to provide services for us in many different ways. If we allow the virus to spread, we're putting all of them at risk, and that's the other side of the equation that weighs heavily. So it's not easy, but I will always err on the side of caution. I'd much rather, as I said in my remarks, I'd much rather have to come forward and say we acted early and nothing happened, and then look at how we can relax perhaps earlier than we thought, and explain that, rather than to sit here and explain why we didn't act when we should have, and have a significant spread of the illness and all the impacts that will have. We will always act in the side of caution and act early and firmly, but always open to reviewing things based on the epidemiology and revising our position.
Next question will go to Alicia Drowse with Global.
Thank you. Dr. Strang, can you just clarify a little bit about what's going on with this AstraZeneca? I'm still confused. So we're getting the 13,000 doses. When are we expected to get them? And will you be prepared with a plan when they actually arrive so that you're not wasting any time in that 30-day limitation?
We don't have final confirmation on delivery. We actually have to give an answer back to the federal government about whether we actually want to take the vaccine or not by midday on Thursday. Every province has to do that. So every province is working through the same process we are. That if we choose the vaccine, how would we use it? And so we're working through, and we have some final recommendations to give to the Premier, so we can meet that timeline for a decision back to the federal colleagues.
Go ahead with your follow-up, Alicia.
And has there been any more headway, I guess, made in the vaccine rollout with the African Nova Scotian communities? I know that was still kind of being worked out last week in the last update.
There was a bit of an update on that given at the technical briefing. I haven't had any more update myself on those ongoing conversations.
Next question will go to Victoria Walton with The Coast.
Thanks. Strang, you said that there were cases in the hospital, I believe 4 in hospital, 2 in ICU. I'm wondering if you can tell us at all whether those are variant cases. Have we seen that the variant cases are making people more sick? And due to those recent hospitalizations that we've seen, are those people?
None of our confirmed cases are variant cases. When you look at the science around the variants, there's nothing that's conclusive that they cause more severe illness. The main concern around the variants is especially the UK variant, much more greater likelihood to be transmitted from person to person. So we don't have any confirmed variant cases. None of our hospitalized cases are confirmed variant cases.
Go ahead with your follow-up, Victoria.
Thanks. And Dr. Strang, this question's also for you. I'm wondering, we've seen other places recommending double masking for the new variants, wearing a second mask or wearing an extra filter in your 2-layer reusable mask is better for those variants. I'm wondering if the province has a stance on that, if you would recommend it.
So the Public Health Agency of Canada recently revised their masking guidance, and we follow that. And what they're saying to people is that a minimum of 2 layers, preferably a 3-layer mask, and if it, we're recommending to people, most people have 2-layer masks. You can buy reusable filters, putting those in as well, and that's the recommendation we're following. I also, every time I've been asked this question, I say, that people not worrying so much about what the type of mask you're wearing perhaps, but are you wearing a mask when it should be worn? And when you are wearing it, are you wearing it appropriately? Are you putting it on and taking it off without contaminating it? Are you wearing it over your nose and mouth with a tightly fitting seal? And most importantly, in the situations where you're required to wear a mask, or other places where it's recommended to wear a mask, are you wearing the mask? Those are the things that really I would ask people to focus on more so than specifically what type of mask they should be choosing.
Next question will go to Pat Healy with The Laker.
Hi, this question's for Dr. Strang. In some communities in East Hants, kids from outside the restricted area all travel in to attend the same school, like Bellman into Emsdale. Why are those same kids not able to attend practices with their teammates?
So thanks for the question, Pat. I mean, it's a difficult decision what we made, putting in the border and the restrictions around asking only essential travel in and out of HRM. And no matter where we draw the border, we're always going to have these challenging issues of people moving for various activities. It's one of the areas that we're looking at actively, and as whether we can make changes to that well before the March 26th that we announced last week.
Pat, do you have a follow-up?
Yes, I do. The Halifax Airport has said on Twitter they've submitted a proposal to Public Health about rapid testing for all arriving travelers at the airport and how it could potentially work there. Where does that proposal stand, and what is the delay in putting it in place?
So we have received a proposal from into my office and the Department of Business from the Halifax Airport. We're looking at that. There's a number of components to that proposal that involved a private third party and some of the associated challenges, including the cost around that. So we're in ongoing discussions directly with the airport around what is feasible, what is actually required at the airport. I think when people talk about airport testing, a lot of people are thinking that if we test at the airport, that somehow magically is going to allow us to remove or reduce the quarantine period. It will not. So it raises the question that we're grappling with about what actually is the value add of testing at the airport. We are looking at how we increase testing at a number of other populations that come into the province, but we're not testing them at the point of entry. We're arranging testing for them through our existing system. So we haven't reached the decision on testing at the airport. Perhaps my answer is indicating it's more complex and complicated than people on first blush might imagine. So we're working through the details of what it could look like and what exactly would be the value add of testing at the airport.
Next question will go to Elizabeth Chu at CBC.
Good day. Premier, in regards to the property tax relief for small businesses, what do you say to those restaurateurs, those bar owners, and other businesses that don't own the property and pay taxes? What are you able to say to those businesses that are struggling?
Well, the vast majority of those businesses, while they pay lease, there's a commercial property tax that they're responsible through the lease payment. So we'll work with those businesses to ensure that they're eligible. This is a one-time fee, and whether you're in a commercial building or you own the building, you are paying commercial taxes, whether directly or indirectly. So the program is designed to benefit all those restaurants that you're speaking of. I would encourage them to reach out to the Department of Business if there are circumstances that we may not have thought of. But the regular case is that those businesses, whether it's downtown Halifax or throughout the province, are paying commercial tax, and this rebate will benefit them.
Go ahead with your follow-up, Elizabeth.
Yes, thank you. And also, Premier, on Friday, there was discussion about the thought of having some sort of sick day program, and that was discussed. It came up over the weekend with a pub talking about developing a sick day program for their employees. Where does that stand for you now, Premier?
Well, it's good to hear that businesses are continuously looking at benefits provided to their employees. There are two provinces in the country that have a provincial mandated system where they provide 1 or 2 sick days. There's federal benefits that are associated with the labor side of things for employees in the country. I'll continue to look at the issue and see if there's anything we need to do at a provincial government level, but I'm encouraged by those private businesses that are there for their employees.
Next question will go to Jonathan McGuinness with CTV.
Hi, thank you for taking my call. Mr. Premier, this question is for you. During a state of emergency, the Emergency Measures Act states that prices for things like food and clothing and fuel are not to increase. Since the state of emergency began almost a year ago, gas has gone up nearly 50 cents. Can you tell me why this has happened? Is there some sort of exemption in place?
Well, fuel is based on the market prices that our distributors here are paying for. They're not able to sell fuel at a loss and go out of business. So I think it's something that needs to be. What the Emergency Act is speaking to is inexorbitant profits. The businesses aren't permitted to take on. So again, there's stock exchange information that regulates the price of crude oil when it comes into our country, depending on where it's coming from, and then there are associated taxes with that are straightforward from a provincial level.
Go ahead with your follow-up, Jonathan.
I'm good. Thank you very much.
We have a few moments to go back to the room for one question. We'll start with Lindsay Armstrong with All Nova Scotia.
Thank you. During our last briefing, Dr. Strang, you mentioned that Nova Scotians need to hang on for 2 to 3 months longer before things get a little better. So, wondering if you could elaborate on that and just make it clear what changes we might expect in 2 to 3 months and what you're referring to.
Well, I think there's several things. We know that if you look at the where we're at on the epidemic curve, if you will, of the second wave, it's clearly coming down. You look across the country, even globally, it's on a very much a downward trend. The one caveat in that is we're still not sure about what impact the variants may play and whether they're going to push that back up, or so we have to be cautious about that. We also know there's probably some of that. All epidemics go up and ultimately come down. There's probably some seasonal component to these viruses, but also as not today, but as the weather starts to warm up, we get outside more, and we know that outdoors, all those outdoor activities, there's less risk of the virus transmitting. We can even have more windows and open, all those kind of things, better air ventilation, all of which decreases the risk of the virus. The third thing is we know that we're building we're building our immunity, our population immunity, and that is why that's a key piece, and that is why this pending announcement from NACI is going to actually it should push us on a much faster trajectory to build up a level, a minimum 70% of Nova Scotians who are immune, even with the first dose. All those factors together give me hope that if we get through the next couple of months, weather, natural trend of the virus, and then the vaccine puts us, as we get into spring and summer, in a much different and better position. But all of those, we got, there's lots of questions and caveats around all of those. So we still have to remain careful around COVID. We still can't relax. We have to get through these next 2 to 3 months. Right now is a very precarious time that even though the virus is coming down, there's still lots of virus activity out there. There's a question mark around the variants. It's going to take time to build the vaccine immunity. So this time right now is very vulnerable. And if we take our eye off the ball and get too relaxed, then we could be into a third wave. Which then we'll have to manage that while we're trying to counter that with a vaccine.
Next question will go to Mike Gorman with CBC.
Dr. Strang, does potentially saying no to AstraZeneca now risk delivery of it to us in the future?
No, whatever decision we make around this initial allotment, 13,000 doses, it has no impact on later down the road when there's other further allotments of AstraZeneca vaccine.
Next question will go to Tim Biscay with the Halifax Examiner.
I've asked you this before, I'm going to ask you again. Cruise ships are talking about starting up their business by requiring people to be vaccinated. Same thing, airlines. After that 2 or 3 months, we're into high tourist season here in Nova Scotia. Do you foresee there being some sort of provincial, okay, you can come into Nova Scotia without self-isolating if you've been vaccinated?
I don't, because what we don't yet know around the vaccines is that we know, because all the trials have been built up around how effective they are at preventing symptomatic disease. We don't yet have the evidence to say they're also effective against preventing asymptomatic disease. And so somebody could be vaccinated. On the data we have right now, I can't tell you that if I'm vaccinated, I can't be an asymptomatic spreader. We hopefully will get that data, but right now we don't. So that's why even if you're vaccinated, you still have to follow all the protocols, including if you're a traveler, the 14-day quarantine. We may get there, but we got to let the science get there. I will just make the comment that the federal government has canceled this year's cruise season. We won't have cruise ships until 2022.
That's all the time we have for questions today. Go ahead, Premier.
Thank you. So good news today in terms of our case counts. Nova Scotians are responding to our calls for testing, and let's keep it up. In terms of our service sector rebate plan, we understand the sacrifices being made by restaurants and other small businesses. They have stepped up and continue to do so. I'm sure you've all read the reports of some pubs deciding not to open, for example, on St. Patrick's Day. Obviously a tough decision, but one that speaks volumes about our business owners being leaders and helping to contain the spread of the virus. Just as these business owners are looking out for all Nova Scotians, it's important that we all continue to look out for each other and treat everyone with respect. And remember, wash your hands, wear a mask, and keep your distance. Thank you.